I've spent over 3 decades opening chests, holding beating hearts in my hands, feeling the fragile rhythm of life itself, pulse after pulse. And if there is one undeniable truth I've learned through all those years of heart surgeries and life-saving interventions, it's this: the enemy isn't always what you think. It's not just clogged arteries or sudden heart attacks caused by poor diets, lack of exercise, or genetics. No, some of the deadliest threats to the hearts I see every day aren't visible under a microscope or on an X-ray. Sometimes, the deadliest danger hides silently, inside the pills we take every single day. Pause for a moment and imagine this: a silent assassin living quietly inside your medicine cabinet, disguised as a trusted friend, ready to attack your heart muscle without warning. This assassin wears many masks: pain relief, blood sugar control, sleep aid, and mood support. But its mission is the same: to weaken your heart, increase your blood pressure, and disrupt the delicate rhythm that keeps you alive. These pills are prescribed with the best of intentions, or bought over the counter thinking they're harmless. But for millions of seniors, just like you, these medications quietly chip away at the strength and resilience of their heart muscle, slowly raising blood pressure to dangerous levels or triggering irregular heart rhythms that can lead to strokes, heart failure, or even sudden death. Man, here's the scariest part: you might not even know what's happening. There are no loud alarms or sudden jolts of pain at first. Instead, there is a slow, invisible decline, like a storm gathering quietly in the distance. Until one day, without warning, your heart gives out. If you're over 60, or you love someone who is, this is not a message you can afford to ignore. Stay with me, because today, I'm going to reveal the 7 most dangerous pills that could be silently destroying senior heart health right now. These are the hidden threats that too few doctors warn about, and too many families never hear until it's too late. And brace yourself, because the number 1 pill on this list might already be sitting on your kitchen counter or tucked away in your medicine cabinet. Pill number 7. NSAIDs, the hidden heart burden lurking in your pain relief. Have you ever taken a simple painkiller for aching joints or back pain, only to unknowingly add a ticking time bomb inside your chest? NSAIDs like ibuprofen and naproxen are household names. They promise quick relief from arthritis pain, joint stiffness, muscle soreness, the kind of relief that lets you get up and move again. But what most people don't realize is that behind the relief lies a dangerous secret. These drugs raise your blood pressure and cause your body to retain excess fluid. Picture your heart as a hard-working pump, tirelessly pushing blood through your body's highways. Now, imagine you're adding invisible weights to that pump every day, forcing it to push harder and harder against unseen resistance. This extra load causes your heart muscle to strain and weaken over time, just like any machine that's overworked will eventually wear out. I remember Helen, a lively 72-year-old grandmother who adored gardening. She took ibuprofen daily to manage arthritis pain, never suspecting this innocent pill was silently worsening her heart condition. One day, she was rushed to the emergency room with swelling, breathlessness, and fatigue. Classic signs of heart failure caused by years of daily NSAID use. Pain relief is essential, but it should never come at the cost of your heart's health and longevity. If you're relying on these pills daily, it's time to reconsider. Talk openly with your doctor about safer alternatives, because every dose might be adding invisible pressure, inching your heart closer to the brink. Pill number 6. Diabetes medications that may be flooding your heart with danger. What if the very medication you take to control your blood sugar was quietly flooding your body, drowning your heart without you realizing it? Certain diabetes drugs, like thiazolidone-etones, including pioglitazone, are designed to lower blood sugar. But they come with a hidden, dangerous side effect: fluid retention. This swelling puts extra burden on your heart, forcing it to work overtime and increasing the risk of congestive heart failure. Even worse, these medications can mask early warning signs of heart failure, such as fatigue and shortness of breath, leaving you unaware that your heart is struggling until it's almost too late. Take George, a 75-year-old man with well-controlled diabetes. He noticed growing tiredness, but dismissed it as normal aging. One evening, he was rushed to the hospital, gasping for air. His heart failure was triggered by the fluid buildup caused by his diabetes medication. If you have diabetes and take these drugs, don't wait for symptoms to appear. Ask your doctor today if safer alternatives exist. Your heart's future depends on it. Pill number 5. Sleeping pills. When your heart's quiet struggle becomes loud, you reach for a sleeping pill, hoping for rest. But what if that pill is suffocating your heart silently while you sleep? Sedative hypnotics like zolpidem and diazepam slow down your nervous system, dulling your heart's ability to respond to stress or oxygen demands during the night. They can also worsen sleep apnea, a condition where breathing stops temporarily during sleep, starving your heart and brain of oxygen. Imagine your heart gasping silently while you rest, struggling night after night to get enough air. This invisible strain slowly wears down your heart muscle and brain function. I've met many patients who blame their daytime fatigue and memory problems on old age, only to find out their sleeping pills were quietly harming their health. Sleep should restore you, not damage you. Before continuing to use sleeping pills regularly, explore safer, natural ways to improve sleep. Talk with your healthcare provider about protecting both your heart and mind with better sleep hygiene and alternatives. Pill number 4. Older antidepressants. When mood lifters become heart threats, could the medication you trust to lift your spirits be the very thing causing your heart to falter? Older tricyclic antidepressants, like amitriptyline and nortriptyline, interfere with the electrical signals that keep your heart beating in a steady rhythm. For seniors, this disruption can cause dizziness, fainting, and dangerous falls that lead to serious injuries. Even low doses taken over many years can slowly erode the heart's electrical stability. While safer, newer antidepressants exist, many seniors are still prescribed these older drugs out of habit or lack of awareness. If you take a tricyclic antidepressant and notice dizziness, heart palpitations, or unusual fatigue, don't ignore these warning signs. Talk to your doctor about safer alternatives. Your heart and your life depend on it. Pill number 3. Decongestants. The cold medicine that makes your heart race. That little pill you pop for a stuffy nose might be forcing your heart to work overtime, and dangerously so. Decongestants like pseudoephedrine and phenylephrine narrow blood vessels to relieve sinus pressure. But this effect isn't limited to your nose. They constrict blood vessels throughout your entire body, forcing your heart to pump against much higher resistance. For a young heart, this may be tolerable. But for seniors with stiffer vessels and weaker hearts, it's a recipe for palpitations, spikes in blood pressure, and dangerous arrhythmias. If after taking a decongestant you feel jittery, dizzy, or notice your heart racing, listen closely. These are urgent warning signals from your heart that something is very wrong. Pill number 2. Heartburn pills that could be eating away at your heart millions. Take proton pump inhibitors. PP is for heartburn relief, but long-term use could be slowly destroying your heart health. PP is reduced stomach acid, which helps with acid reflux. But stomach acid is also essential to absorb magnesium, a mineral critical for heart rhythm and muscle function. Over months and years, low magnesium can cause irregular heartbeats, fatigue, and muscle weakness, all red flags for heart disease. PP is also disrupt your gut bacteria and promote inflammation, a direct path to heart problems. It's like putting out a small kitchen fire, but allowing termites to eat away at your home cell foundation. Everything looks fine on the surface, until suddenly the whole structure collapses. If you've been on PPs for months or years, ask your doctor if you can safely reduce or stop them. Your heart will thank you. Pill number 1. The most common heart medication that could be slowly harming you: calcium channel blockers, often prescribed for high blood pressure, chest pain, or arrhythmias, might be the most dangerous pill of all for seniors. Older versions, like verapamil and diltiazem, can slow your heart rate too much, cause swelling in your legs, and dangerously lower your pulse. Symptoms like fatigue and dizziness often get dismissed as just aging, but they could be side effects of these medications. I've seen countless seniors come through my operating room with heart complications traced back to these drugs, medications meant to protect their hearts, but quietly weakening them instead. If you're taking calcium channel blockers and notice swelling, breathlessness, or a slow pulse, Don't brush it off. I'd talk to your doctor. Ask if newer, safer options are available. Your heart deserves vigilant care. Your heart is irreplaceable. Every beat is a precious gift, a rhythm that carries your life forward. Don't let it be stolen by hidden dangers lurking in your pills. I'm not telling you to stop any medication without consulting your doctor. But I am telling you to demand better care. Be curious. Ask questions. Track your symptoms daily. Insist on regular checkups and heart monitoring. Because far too many seniors end up in my operating room not because of their disease, but because of their medicine. Protect yourself now with the Senior Health Tracker app, specially designed for people over 60 to keep detailed track of medications, symptoms, and early warning signs before it's too late. This app is your lifeline, catching problems early, empowering you to act, and helping you stay one step ahead of heart trouble. Access is limited this week. Don't wait until your heart gives you a warning you can't ignore. Click the link in the pinned comment or description right now, and give your heart the protection and respect it deserves. Stay informed, stay vigilant, stay heart strong. Your heart's future is in your hands.